You're listening to the new media. You're listening to Mitchell Talks. Learn more at MitchellTalks.com and follow me, Scott Mitchell, on Twitter at MitchellTalks. Dr. Sunil Aggarwal, MD and Ph.D., is a physician and scientist with the University of Washington School of Medicine. He's originally from Oklahoma. He's a supporter of medical cannabis and State Question 788. He's also a contributor and appeared on camera in Weed the People, the Ricki Lake documentary, which was recently featured at the deadCenter Film Festival in Oklahoma City. Tuesday, Oklahomans will vote on a proposal to legalize medical marijuana. I spoke recently with Dr. Aggarwal when he was in OKC for deadCenter. Tell me how you came to be involved with the motion picture.
Oh, Weed the People. I got the producer and the director. I met them at a conference, a patient advocacy medical cannabis conference in Washington, D.C., which I was speaking at. I was invited to give a talk there on the science and chemistry of cannabis and medical applications when I was a resident in NYU. I'd already published a lot of articles and done some original research, and so the conference asked me to speak, and so I went there, and then I met them. They were meeting other folks there at the conference, and they said, "Oh, wow, we want to interview you, for our documentary." And I, of course, knew of Ricki Lake from her talk show days when I was living here in Oklahoma. Would talk about it at school, and so it was a great experience for me to get to meet her and her the director Abby, who'd done some amazing work on things like the vagina monologues and other amazing creative work, and then The Business of Being Born, which was a big documentary about how we don't really to rehumanize birthing, basically, which was my wife was pregnant at the time, so it was a topic that we were thinking quite a bit about. So that's how I got involved.
Now, your folks are still in Oklahoma. You know what we're in the midst of. There are two distinct camps in Oklahoma. There is the medical marijuana discussion. Then there's the State Question 788 discussion. The battle is going to be fought for the middle for people who might be for medical marijuana, but opponents would say, but yeah, this one over here, this is not exactly as advertised. This is more about going around the law for full-fledged recreational. What do you think people in Oklahoma should know in terms of, you're looking at it 10,000-foot level.
Mm-hmm, yeah.
So that's the reality of what's about to happen here. The medical aspect of it that the media won't talk about, what is that?
Mm-hmm. The medical aspect is the key, is really the only issue. How much do Oklahomans trust their doctors to make good medical decisions on their behalf? As long as you can trust your doctors in this state, and I was almost going to be a Oklahoma my father's an Oklahoma was Oklahoma doctor for many years. He's still licensed, did nuclear medicine at the VA hospital. I had many of my family friends were doctors in Muskogee, cardiologists. The first time I saw, operating rooms was in Tulsa at Hillcrest, and I saw lots of Oklahoma doctors growing up. That was our community, and I even got accepted into the OU Medical School, where the MD PhD program, a full ride, and I ended up going to Washington instead. So I have strong faith in the medical community in Oklahoma. I still kind of feel like an honorary part of it, and so I think what's nice about this initiative is that it gives the doctors a lot of freedom to appropriately treat their patients the way that they feel fit, not getting a lot of micromanagement about their, minutiae of their medical, clinical decisions from somebody who has no medical education, who's never treated a patient in their life, never written a prescription, never dealt with, complex multiple drug allergy patients who have, all kinds of traumas or, autoimmune diseases and genetic disorders. We got all kinds of things in medicine. It's messy. It's not as clean cut as, somebody who has never been in the hospital or, clinic would guess. So this initiative is extremely, patient-centered and doctor-patient relationship protective, and that's pretty unique, and that's pretty. I think people are just so worried that their doctors, maybe they don't have faith in their doctors, or they think their doctors are gonna, go carte blanche and, write medical marijuana for non-medically appropriate scenarios. I think that's kind of like, well, have you seen your doctors signing off on their kids' athletic physicals just because, they want their kid to play sports, and they're going to let their kid who has some problem, get out there, and, it's going to be on the doctor if a kid gets hurt because they didn't properly, check them out for a certain vision problem or movement problem. I mean, doctors do a lot of things to make sure people are safe in the community. Physicals, disabled parking permits. We do a lot of things. We entrust them to make the right decision, and they have a lot of latitude. I'm sure a lot of people might be walking around with disabled parking permits, and people worry, are people getting those inappropriately? There may be one or two doctors who might do that, but the vast majority, they're appropriate. And this initiative actually says the doctor needs to be reasonable and prudent in their decision making. So the more you rely on that, you're going to create a more inclusive medical cannabis system. The marijuana, cannabis will be available more appropriately and easily when patients don't have to jump through too many hoops. They don't have to pay so much money, drive so long distances. And that's not recreational. That's just really good open access medical care for people with the least means. And that's a people's-centered, patient-friendly scenario. And I think the other side is saying, hey, no, we need to make this much more restrictive and make it harder. And well, yeah, it's always a good idea to restrict healthcare, right? I mean, that really works out super well. I think the only reason you would do that is if you're, just worried that, maybe you want the market to be taken by big companies who are going to have much more FDA-approved cannabis medicines, and that stuff is coming down the pipe, and that stuff will cost a pretty penny. The FDA-approved CBD tincture that's or soon to be approved, $80,000 to $100,000 a year. The Wall Street Journal has estimated it would cost a patient. Of course, your insurance might pick it up, but that's only if you have one of the improved labeled conditions. A certain type of seizure disorder. If you need it for something else, well, sure, it's available for off-label prescription, but you got to pay, maybe 5 figures. So who knows, 6 figures a year. So it's about money, and it's about who's going to control this valuable plant medicine. And this initiative is about letting Oklahomans have a much greater control over this resource. And that's, to me, looking at the 10,000 foot level, and I've seen lots of state programs. I lived in California. I work in Washington. I've seen what's happening in Oregon, in Hawaii. I've testified. I worked in New York. I saw New Jersey's dysfunctional program. I gave talks in Jersey. It is the more the programs are centered around doctors and patients and trusting them to make good decisions, to allow, and the more you have ability for patients to cultivate their own cannabis, the lower the costs are going to be and the more accessible it is, and that's going to make a big difference. So that's my really thought about the matter.
You have seen the stories about the state health department being $30 million in debt. We are last in virtually all health categories in Oklahoma. If it wasn't for the Southeast Conference, we'd be dead last. I'm talking Mississippi, Alabama, Kentucky. We have a $1 billion fund in Oklahoma to stop smoking. It just keeps getting worse. Health outcomes are horrible. We just, in the last couple of years, got CBD oil, but it has real low levels of I believe no THC, the law. Right. As you look into your crystal ball past this debate down the road, because if it goes down, it'll probably be back at some particular point.
Sure.
Knowing we're a health wasteland and knowing what's going on around the country, look into your crystal ball and tell us what we're going to be looking at in the next 5 years in Oklahoma, if 788 passes or not. What's on the horizon?
Yeah, I've seen those dismal health statistics. It's I saw it growing up. It's about diet. It's about lifestyle. A lot of those issues are also related to lack of access to good quality. Even dental care is hard to come by in Oklahoma for many people, and you don't get good dental care that has implications for your, infections and other illnesses, and your ability to choose certain types of food that you might need, and roughage. I mean, public health is it's an incredibly important thing. I did my other degree in medical geography and studied a lot of public health going to college and grad school, so I'm familiar with these mortality and morbidity statistics. I don't think that Oklahomans are just going to let that situation go, and I think cannabis is not going to, solve all the public health ills, but it certainly is something that can help to alleviate some of the worst scenarios that are going on around overuse of certain classes of medications that cannabis can probably supplant. And we have enough evidence from Medicare Part D prescribing data that's been compiled by some professors in Georgia, a daughter-father professor team that have written some great papers on analyzing the numbers from all of the states, Medicare's, and including those southern states, but not a lot of them have functioning medical cannabis programs. But when you do have a program, the number of prescriptions for certain classes of muscle relaxants, opioid pain relievers, anxiety relieving drugs, they actually go down. So if you are using less of those, you're using more this plant medicine, which has less risk factors, you might get less opioid-related hospital admissions. That's been shown in another study as well. So you'll have more money available to treat, preventatively rather than, acute problems. And it's all about making sure the budget for prevention is there for health education, smoking cessation, reducing the food deserts. Oklahoma has the highest incarceration rate in the world. That just came out yesterday, and that's there's no good health care in prisons. You can't do it very well. So this is an initiative that also is looking at that public health crisis. That's a human rights crisis, and I know there's previous cases about patients who were using marijuana for medical purposes who went to prison and they lost their limbs because they were so sick in wheelchairs. As Jimmy Montgomery, he was from southeast Oklahoma. He was using marijuana for muscle spasms and pain, and he was sent to a just done correctional facility, and he got an infection and had to have his limb amputated. It's a true case, and he got multi-decade prison sentence, and that was in Oklahoma. That's the kind of thing that our prisons do to people who are associated with marijuana who are sick. That's what we've been doing for so long. So you want to, I'm sure he had multiple hospital visits due to that, and if he was doing fine on the outside with marijuana, we could have saved all that money and used it for other prevention. So less use of the prisons and the criminal justice system, more preventative health around pain and anxiety and other things, that muscle relaxants, that and probably anti-nauseas, all the things that we're already spending money on. If people are going to be able to spend it through this system, it'll be a net savings. So, and then hopefully, we'll take more matching federal dollars to help the patients who are on fixed incomes, sooner care type programs, and of course the education system. It's all very interlinked. Health crises like that are interlinked to economic issues, social and economic issues. So the more that you can improve the social and economic situation. And in cannabis, it's an agricultural commodity, so there's got to be a lot of work involved in cultivating, processing, distributing, testing, labeling, setting up sales, and then the ancillary services for all that. It's an industry, and people are gonna get some gainful livelihoods out of that. So I'm sure that'll help help with people's paychecks, and they'll be able to spend more money on preventative health. I'm sure a lot of problems that are happening, they could have been prevented if people had been able to see doctors or afford their health care. So that's kind of how I see it down the road.
AP had a story that's on our News 9 site today from Friday. I don't know if you've seen this. The president said Friday he was inclined to support a bipartisan effort in Congress to erase the U.S. ban on marijuana.
Yeah.
AP says a proposal that would dramatically reshape the nation's legal landscape for pot users and businesses.
Mm-hmm.
Your thoughts?
Oh yeah, I was very happy to see that. It is really we really have never. This is the first time in the history of ever since Richard Nixon put marijuana in this banned category that denied its medical utility, which was itself a farce. We knew that marijuana had medical utilities. We had it in the pharmacopoeia for 100 years. Oklahoman physicians were prescribing marijuana back in the 20s and 30s. And even prison doctors were prescribing marijuana. We have prescriptions, copies of their prescriptions. You can see on antiquecannabisbook.com. Anyway, so now the feds are saying since that time, we actually have bipartisan, bicameral legislation that's been dropped in both the House and the Senate. And it's bipartisan, Republican and Democrat, and in both houses. So that's never happened. And we have the executive, the man who has the power to veto or sign bills, saying, yeah, I think I already know what is going on here. And he'd already mentioned earlier in a couple of news cycles ago that he and Senator Gardner from Colorado had worked out an agreement that Gardner was no longer going to block his U.S. attorney, or whatever his appointments anymore, because Gardner wanted them to have something worked out. And so, assuming Trump shows us the art of the deal and closes that deal, we may eventually get to a point where the federal government is no longer our greatest challenge. And now Oklahomans actually have to take this on themselves. The federal government saying, okay, we made a mistake and we're just going to back out. So, guess what? The 10th Amendment to the Constitution basically makes the states be responsible for their own health and wellness of their people. That's why doctors are licensed by their states. The medical practice is not licensed by the federal level. It's licensed at the state level. Public health departments are a state level issue. The feds do help, and then the feds do license doctors for their DEA registrations. But now that issue will fall to the states, at least on marijuana, if that passes. So it's a good time to really look at and see how we would do it. Hopefully the feds will also recognize that we can do nationwide regulations and standards around just like we have other herbal medicines that we have federal guidelines called the Dietary Supplement Health Act that Senator Orrin Hatch had supported back in the 90s. He's from Utah, and he's now in favor of the medical use of cannabis as well. So the feds can help us in terms of some general guidelines for safety and quality testing in that field. Now, some supplements don't get good quality testing, so that we do need to reform that system as well. But by and large, Oklahoman will now have to ask itself, boy, the feds are no longer in this, don't have the heart to ban marijuana anymore. Do we have the heart to do that? Do we really think that marijuana is associated with criminality? And I think that's a big question for us to. News tells me that Oklahomans have to start seriously rethinking their marijuana laws, and probably lots of their other anti-drug laws. The war on drugs is is based on the idea that people who use a drug should be criminalized, but addiction, if it's an addiction problem, we know that that's a disorder of social bonding disorder, and you treat them by giving them help, not by ostracizing them and making them feel more shame. So I think it's going to be a nice. It actually puts a little bit more responsibility on the shoulders of the voters. This news from the White House.
See if Washington, Oregon, and California come into play in the next election for Trump. All right, my very last question.
Oh.
You're seeing the coverage of this issue here and in other states. What's the responsibility of the media moving forward on this issue? Because there's stereotypes and old history, and we just read the story about what the president just said on Friday. What should the media be doing the next 2 weeks in Oklahoma?
Yeah, there's some of my friends. I should plug Cannabis Wire, which is Columbia Journalism School graduates actually started a cannabis media company, and they have little guidebooks for media, how to properly report on the topic, and don't use these silly puns. This is the scientific facts. These are the legal facts. And I actually have done, I've been an advisor to a master's Columbia journalism student on their thesis on marijuana. So The more that the journalists do deep investigative reporting, if they're reporting on science, they need to talk to the International Association of Cannabinoid Medicines. They need to look at people who are working on cannabis as medicine in other countries where it's already been legal and approved. Don't talk to doctors who've never actually used this in their practice, who are just talking theoretically. Talk to doctors who actually have experience. They need to recognize that the WHO is doing international considerations and scientific reviews of cannabis as we speak in Geneva right now. I mean, this is not just some you just listen to the local doc who doesn't know anything about it. You need to go to the health authorities internationally and in other states. So the media needs to be up their game to that level. And then as far as puns and jokes and it's all recreation and things like that, if a doctor is involved, again, what things do doctors sign off that's recreational? What does it mean? Ask a doctor, what does it mean to sign a medical cannabis authorization? What are aspect of their reputation are they putting on the line, of their professional credentialing? What is the medical board that regulates doctors? What do the medical boards say about doctors' involvement on this in other states? Is that part of their practice of medicine? Oh, did the Federation of State Medical Boards issue some guidelines for state medical boards for doctors issuing this? If they did, that's something that we should know about here. I haven't seen enough looking into the details of these practices in just neighboring states, and that's kind of if we're going to be doing this, the Oklahoma people need to know that they're not embarking on some terra incognita, but they just things that they actually are, that the rest of this country is getting more familiar with. And then, as I said, the international stuff is very interesting because, we don't have to be like New Jersey, or we're going to be Oklahoma. So we can learn from other countries that are doing this, like Israel is very ahead of the game, and so we don't need to. We don't just have to restrict ourselves to the U.S. So that's all I would say, and I think the media has been trying to really follow this and pick up stories of patients, and they've been doing that very well. And they've been tracking all the people who leave the state, and that's very important information because people don't migrate just for fun. I mean, there's young people do that. They want to go explore the world. I left Oklahoma when I was 17, 18, and I wanted to see other places. But now I have a family, and I wouldn't uproot my family, just for fun. It would be schools, healthcare, education, employment and livelihood, like serious bread and butter stuff. So I'm very happy that they've been looking at the migration issue, because that tells you there's something real here.
It's good to see you back in Oklahoma. Dr. Sunil Aggarwal, we've got more interviews lined up over here, and always good to talk to you. Congratulations on the movie. It's called Weed the People.
Weed the People.
Abby Epstein and Ricki Lake, and you were in that movie and a contributor in that, and it was very interesting, thought-provoking film. Thanks for being with us.
My pleasure.
You're listening to the new media, the Mitchell Talks Network. Learn more at MitchellTalks.com and follow me, Scott Mitchell, on Twitter @MitchellTalks.